Hello, Fit Fam, and welcome back to another episode of the Fit Doc Podcast. This podcast is where we discuss how to stay mentally fit and physically strong. We have guest experts who come in and they discuss topics that you care about, along with current health and wellness trends. The point of this is to make sure that we encourage you to learn how to implement wellness into your daily routine. Today, we are talking about the importance of colorectal health. This episode was recorded in front of a live studio audience during our partnership with the Long Island Nets. Not only are the Long Island Nets an amazing basketball team, but they also help to provide education and services to our community. And by partnering with them, I hope that we bring more wellness education to Long Island. Our guest for today's episode is Dr. Lynn O'Connor, who is the Director of Colorectal Surgery of New York and the Section Chief of Colon and Rectal Surgery at Mercy Medical Center and at St. Joseph's Hospital on Long Island. I love what Dr. O'Connor is doing because not only does she focus on your GI health, but she also focuses on food and exercise. And you might not realize you are what you eat. And depending on how you exercise, that plays a major role on your colon and your intestinal health. As far as hot topics today, recently in February, we celebrated Women's Physicians Day. 54.2% of doctors in the United States are women. But our job is to make sure that we increase the number of females that we have in the field. Women physicians remain concentrated in fields like family medicine, like I am, and in pediatrics, but we're starting to see women in all fields throughout medicine. Medical schools are also seeing an uptick in the number of women who are being admitted to medical school. And I think as a female, it's important that we also recognize that there is a disparity of what's going on in the field of healthcare, but then also as a woman, we also face discrimination and pay parity issues. Being a female physician is full of many challenges. I love my job. I appreciate what I do, but I also want to make sure that I encourage other women to go into the field.
So we are back for our next segment, and I would like to say that it's been a great day so far. And one of the things that I like is that, especially being a Black physician, is having a network of other Black physicians, because sometimes people do want to see people who look like them. And it's great that we have people in different fields that can support us. I have to say that as being a doctor in my own private practice, knowing someone else who's in their private practice, especially a colorectal surgeon who has their own private practice, Dr. Lynn O'Connor, is a big honor for me. And the reason why I say that, because I know everything that it takes to start your practice, to maintain your practice. And come February 2nd, it'll be 21 years that I've had my own private practice. So deeply appreciate each of you for supporting me along the journey. Now, Dr. Lynn O'Connor, you have your own private practice, but if you could just give us the name of your practice and your location, so that way we'll just jump off and we'll get started with the questions.
Absolutely. But first of all, kudos to you. 21 years. We know how hard it is, especially being a Black female out there. So that is phenomenal.
Thank you.
I'm Dr. Lynn O'Connor. I am a colon and rectal surgeon. I have 2 offices. I have one in Huntington, 380 Park Avenue, and I have one on the campus of Mercy Hospital at the Ryan Building. And I'm also chief of the Division of Colorectal Surgery, both at Mercy Hospital in Rectal Center, New York, and St. Joseph Hospital in Bethpage, New York.
Congratulations. All right, so jumping right in, because some of you might follow me on FitDoc, Michelle Reed on social media, be it Instagram or Facebook or Twitter. And I ended the year going for an endoscopy. And we always talk about the importance of your gut health. And as a doctor, we have to practice what we preach, because we both exercise.
Absolutely.
We
Yes.
both love to be outdoors. We both love to eat. So I thought this would be the perfect way for us to start off by talking about our nutrition.
Yes.
And I always say people like garbage in, garbage out. You are what you eat. And when I can't fix them, I refer them to you. So where do you start when you see a patient? Because I know you don't just go in like, oh, you have belly pain. Let's just focus on that. How do you see a patient holistically before you decide what you need to do for them?
That's so important because that's one of the things that I am passionate about is the holistic approach to a patient, because there are so many things that are involved in your gut health. It's not just what you eat, and it's not what you don't eat. It's a lot that goes into it. So when a patient walks into my office, the first thing I'm doing is assessing them as they're walking in. I'm assessing their size, I'm assessing their countenance, I'm assessing whether or not they're upbeat, whether or not they're sad, what's going on. I've had patients who've come into my office and they're complaining of constipation. You just delve a little bit more. They're in the middle of a divorce. They've lost their job. They're depressed. You're not going to eat if your mind and gut is not in sync. So before you start throwing pills and potions and concoctions at a patient, you have to talk to the patient. You have to develop the rapport. You have to see what's going on. There are some patients who may be on certain medications, and certain medications may take away their appetite. It may cause them to eat more. It may cause indigestion. So there's a whole host of things that go into a person's gut health. That's not just necessarily the food they're in. And I completely agree. Garbage in, garbage out. And I tell my patients, you are what you eat. And that's one of the strong tenets of gut health, is making sure that you're putting the proper things in.
So can we talk a little bit more about that mind gut connection? Because I know with certain GI disorders like irritable bowel syndrome, I remember when I was in medical school, like you go to the bathroom, to urinate, just to release the bladder, and there'll be people in there having like diarrhea, explosive episodes. And we don't really talk about that mind gut connection. So can you delve a little bit deeper into it for us?
One of the things about when you talk about IBS is a diagnosis of exclusion. It's irritable bowel syndrome, not to be mixed up with IBD, which is inflammatory bowel disease. So IBS is usually when patients have GI upset. There's diarrhea, there's constipation, they can't digest certain foods. And a lot of times people have a significant amount of anxiety. And if you think about what we've just been through over the last 2 years with the pandemic, people are losing their jobs, they've lost loved ones, they're scared, they're not back to their norms, they've had kids who've been home for too long. So all of those things can cause a lot of anxiety. It can also take you off your normal routine. Because for me, the gym's closed. I used to go every day after work. The gym's closed. So when you're off your normal routine, when you're off your normal eating habits, when there's a lot of angst, uncertainty in your diet, that in your life, that can affect your gut health. And when that happens, some people react differently. Some people may have diarrhea. Some people may have constipation. Some people may not move their bowels at all. You may be going normally, and then you go every other day. So there's a significant connection between the mind and the gut. And additionally, depression affects that. In we have certain hormones that we have in the gut. And the gut is important in immune function and also hormone production. And serotonin, which is one of the happy hormones, 90% of it is produced in the gut. And your mood, your well-being is very central to how your gut health is.
So now, is that the reason why sometimes right after somebody exercises or runs a race or does some type of intense physical exercise that then they have that urge to go to the bathroom and have a bowel movement?
No. I do have what a lot of my patients call runner's diarrhea, which has unfortunately affected some of their ability to run for prolonged periods of time. But usually what happens when you exercise, just in general, exercise is important because it stimulates blood flow to the muscles in the gut. And when you're stimulating blood flow to muscles in the gut, that's going to increase the activity. That's called peristalsis. That's the bowels moving and pushing the food through. So that may be increased in certain instances of high activity and exercise where patients will go to the bathroom. Conversely, if you're not working out, and if you're a couch potato and you're sluggish, that access is actually going to be a lot slower. And that's when people have constipation. They're not moving their bowels, which can lead to other issues such as hemorrhoids, fissures, fistulas, things of that nature.
So then what you're saying is that it is important for you to exercise.
Oh, key. Yes, absolutely.
And then
Absolutely.
how much exercise do you encourage them to do? Because that's going to give them that healthy bowel that they need so they can go to the bathroom regularly.
So what's recommended is 30 minutes of moderate exercise daily, so 150 minutes a week, or 75 minutes of vigorous exercise. And you should sprinkle in there 3 or 4 days of weightlifting, because that's what's going to be important too. When you increase the muscle mass, you're going to be able to increase your caloric burn. But a lot of people think you have to go to the gym and start doing squats with 300 pounds. You don't. You can actually exercise in intervals throughout the day. You can do 10 minutes in the morning, 10 minutes at night, 10 minutes during the day. When you're at your lunch break, get up, get out of your office, start walking around. Those are the things that's important. Park further away instead of right up against the the building. Make sure you take the stairs. I'm always in the hospital. I'm taking the stairs 4 or 5 flights a day. So those are some of the things that you can do to increase your physical activity. So it doesn't have to be a huge, intense workout. You can do it in spurts. And I mean, gardening, dancing, there's so many different things that you can do. Just walking, simple and exercise walking program around your neighborhood, in the track, in the mall if it's closed. Just getting off of the couch saves lives. And there's also a study that said in patients who have had colon cancer that hasn't been metastasized, the simple adoption of exercise even after surgery may stave off recurrences. So exercise is key to our life in so many different fashions and forms, especially for gut health.
Good. So now that you touched on colon cancer, I know the standards have changed, the recommendations, because originally they were recommendations for 50,
Yes.
and then it went down to 45 years old if you were black, and then now it's 45 for everyone.
Correct.
If we find out that we do have a family history of colon cancer, when are you recommending that we do get checked out instead of waiting till 45? Because there are some people who are like, they are adamant, like, oh, I can't go until I'm 45 years old. It doesn't matter that I have a family history.
Oh, no, definitely. The way it works, first of all, it's 45 hands down for everybody. If you have a family history of colon cancer, and we're talking about family history in the first degree relative. A first degree relative is someone that's mother, father, brother, sister. Now, it's important to know about your aunts, uncles, and grandparents, because our families are much smaller now. But when you're talking about a first degree relative, we're talking about mother, father, brother, sister. So if your mother, father, brother, sister had colon cancer, say at age 40, then you want to start screening 10 years prior to that index case. So if it's 40, then you want to start at 30. Now, if they had it at 55, you're already going to be at 45, and you're going to start that. If there's some cancers that have a genetic predisposition, you may need to start screening sooner. And I always tell my patients, because unfortunately, we are seeing colon cancer in younger and younger patients. My youngest patient I had to take care of was 23 years old with metastatic stage 4 colon cancer, which was horrific. So if you are having symptoms such as rectal bleeding, change in bowel habits where you were normally going every day, you're not going every day anymore. If the stool is thin, pencil thin, if you're losing weight, if you're what we call early satiety, where you're not, you get full pretty easily. Those are the things that you look at, and you just come right in and get a colonoscopy screening.
Yeah, because I notice that sometimes I'll have a patient and they'll say, well, I just noted that I had a little blood and it comes off and on. Or they'll say, well, I've been bleeding for like the last month. I had one recently. But somehow we have to get them to know that it's important not to wait until a month out or 2 months out, because when that happens, that's when we have the metastatic cases.
Exactly. And it's important to understand that no rectal bleeding is normal. It's not normal. You may have hemorrhoids. And a lot of times people say, oh, it's my hemorrhoids. Especially women who have been pregnant, they've had multiple births, they labored for prolonged periods of time with C-sections, and they think it's just hemorrhoids. It's not just hemorrhoids. Sometimes it's something more, sometimes it's something less. But the most important thing is just to be evaluated. If you're evaluated and it is benign, wonderful, because the majority of rectal bleeding is benign. but some of it's not. So the important thing is to see your primary care physician, be evaluated, and if necessary, you get further workup.
Okay. Now, as a colorectal surgeon, you're not just doing colonoscopies. Can you
No.
just tell us a little bit more about like your entire role?
Yes, I don't do just colonoscopies. I take care of the entire colon, rectum, and the anus. So that involves colon cancer resections, rectal cancer, diverticulitis, rectal prolapse, hemorrhoids, fissures, fistulas, abscesses, anything that has to do with the gut, ulcerative colitis, Crohn's, patients who have chronic constipation, chronic diarrhea. And I also like to do it, look at it in a preventative method as well too, because I counsel my patients just like you on the importance of exercise, eating right, activity, diet, and things of that nature, and also looking at their medications because sometimes their medications may contribute to the bowel problems that they're having. So it's a complete holistic approach for the patient.
Now, since we're talking about holistic approach, this is dry January, so I don't know if anyone has or indulges in alcohol, but dry January is when you don't have any alcohol for the entire month. So, how does alcohol affect your gut?
Alcohol has a significant effect on your gut. Now, I know a lot of people think, they've heard that the red wine is good for you, and they used to say two glasses for men, one glass for women. Well, it's updated. One glass for men, one glass for women, if you're going to have it. You don't need to start drinking to improve your gut health, but but if you do drink, that's really the limit. Alcohol has an effect on us significantly because one, if we're out and we're drinking and we drink a little bit too much, it lowers your inhibitions. So you're going to start eating those fried foods that are on. You're going to start eating the wings. You're going to start eating the French fries, and you're going to start eating unhealthy, and that's going to derail you from your health goals and your weight goals that you want to have. That's the first thing. The second thing is that alcohol actually causes dehydration. So when you're urinating out all of that alcohol, you're not absorbing the food into the water into the gut, and then we're dealing with constipation along with the cotton mouth and the GI upset and the discomfort. So that's something that you really want to do in moderation. And if you are going to have alcohol, have a glass of water for every beer, every glass of wine, every hard drink that you're going to have, at least.
So now you're making me think about detoxes because, I think sometimes when people overindulge the next day, like, oh yeah, just make sure you drink a lot of water and take your vitamin C and your multivitamins and you won't have a hangover. But then they're like, I just got to detox everything out of my system. So as a colorectal surgeon, what is your take on detox?
I do not believe in any motions, potions, concoctions, detoxes, cleanses. Your body, if you treat it right, what you put in properly, it will work properly. Detoxes are very dangerous sometimes because you really don't know what's included in what you're doing, and you can get to a point where you're going to be deficient in certain vitamins and minerals. There were people who are only doing that lemonade, honey diet. Things of that nature. They were doing the cinnamon diet. If you eat a well-balanced, well-rounded diet, and if you're drinking enough fluids, that's what you need to do. The detoxes, the cleanses are also problematic because people, when they do the colon cleanses, you can infuse too much water. You can perforate the colon. I've had people who have done coffee ground cleanses. They've burned their rectum. So, because they heated up the coffee.
Oh, wow.
There's just so many different things that people have done and so many different concoctions. The bottom line is just eat right. If you eat a well-balanced, healthy diet with lots of fluids, that's all you need to do. And your colon doesn't need to be clean. Your colon needs to be balanced. It needs to be balanced with the right amount of good bacteria and bad bacteria because that's where the bacteria lives. You need the bacteria in the colon. So you don't want to cleanse it to the point where there's no bacteria.
Wow. I heard some like sighs and what? Are you kidding? in the audience.
You wouldn't believe what I see. You wouldn't believe.
So I'm just going to put a pause on you for a quick second. Does anyone have any questions for the good doctor?
I'd like to know, and thank you very much. Everything so far has been very, very informative, and I'm a nurse for almost 49 years. Question, what do you feel about probiotics?
I think probiotics are absolutely wonderful. Probiotics are
Thank you.
phenomenal, and you can get probiotics over the counter, but also just if you're eating the proper foods. There are certain foods that you can have, like the fermented foods, like kefir, kombucha, yogurt, miso, sauerkraut. Those are all the kinds of foods that will help repopulate the gut if you need to, and that helps with antioxidant formation, antimicrobial, antifungal, glucose. I mean, it's just absolutely wonderful for probiotics. I thoroughly believe in them.
So
I
what
should
about the
have brought my-
prebiotics?
Prebiotics are fine as well too.
Okay.
As long as, and you can get them from your foods. I mean, just certain yogurts, when you have the lactobacillus and bifidobacillus, all
Bacillus.
of bacillus, all
Yep.
of those are perfectly fine.
Thank you.
Good afternoon. My question is it true that you should move your bowels 3 times a day, and is that rational? I mean,
I get that question a lot. And that the thing that's important is, no, you don't have to move your bowels 3 times a day. What you need to know is your normal. And when you differentiate, or you defer from your normal, that's when it's a problem. Some people go every day, some people go twice a day. And if you go 3 times a day and that's your normal, that's fine. It depends on what you eat, your diet, and your activity levels. Some people go every other day. What you're looking for is if you have a significant change from your normal bowel habits in terms of frequency, in terms of consistency, in terms of size. Those are the things that you want to look for. But no, you don't have to have a specific 3 times a day bowel movement in order to be considered normal. Not at all.
What about if you're having pain when you have a bowel movement?
You should not have pain with a bowel movement. That's an indication for you to be checked out. And there's certain things that can cause pain with a bowel movement. If you're straining and you're constipated, sometimes you'll rip the anal canal, and that's something that's caused a fissure, and that's an excruciating, extreme amount of pain. Sometimes patients may have abscesses that have formed, and that's going to cause pain when you have a bowel movement. So sometimes patients also strain so much that they can come up with a thrombosed external hemorrhoid, which is a large swelling on the outside, and you'll have pain at that time with a bowel movement. And there are some times where you may have ulcers or sexually transmitted diseases that may cause pain with the bowel movement. So pain is not normal with the bowel movement, and that's important to know you're normal.
I have a two-part question, really in diversity. One part is dealing male-female. In terms of the patients that you come into contact with. I know women tend to be more in tune with their bodies versus a male patient. So in your experience, I guess I'm asking, what has been your experience, or are there some generalities that you have come across in your years of practice?
I treat both men and women, and I always tell my men I have a smaller finger. So so it makes them, they're a little bit more relaxed. But I do treat men and I do treat women. Women, by virtue of the fact that they are interacting with the healthcare system a lot sooner than men, because of gynecological checkups, because of children, because of taking kids to the pediatrician, they tend to be the head of the household when it comes to health decisions. And a lot of times, women are bringing their husbands and their family members in because they're the ones who are making the appointments. So they're really the ones that take care of the health of the family for the most part. But I do have a significant number of men, because of awareness, because of outreach, because of programs such as this, where people are educating, they're learning, that they know to come in. And they know that, hey, I'm 45, let me go ahead and get my colonoscopy. Or, you know what, doc, it's been a little bit painful when I move my bowels. I just want to know what's going on. Or I saw some bleeding. I'm not really sure, so I want to come in. But it is true. Men sometimes need a little bit more coaxing, but I have seen more and more men take more charge, and they're more informed, and they are more comfortable coming in to see doctors now. And especially when they see someone of color that looks like them, they feel a little bit more comfortable as well, too.
Okay, and my second question is more on the lines of ethnicity, in terms of perhaps diets, or what, in terms of what are you seeing, because different people have different diets, they eat different things, or they come from different countries, etc. Are you seeing any differences where people may have more disease in one area more than the other?
I think that's a wonderful question. And if you look at all of the different ethnicities, everyone eats differently, but everyone still has vegetables. Everyone still has fruits. They may prepare it differently. They may use different sauces, but it's important that they understand the importance of the diversity of your diet. You want to have more fruits, you want to have more vegetables, you want to have more fiber. Now, what I am seeing is that when you have the second generation of people who are immigrants who are coming to the United States, they tend to have the same amount of disease processes with the obesity, the diabetes, the high blood pressure that Americans already have that they come here. So they kind of lose a little bit of their culture, if you will. They're, instead of eating at home, they're eating at McDonald's. Instead of, cooking at home, they're eating fast food, and that may be because of their lifestyle now, that they're on the run. They've got 4 kids, they have to get to soccer, or so forth and so on, or they're working late, or you have 2 parents who are out of the household and they're not cooking. So, depending on people's culture, their lifestyles, I do see a difference. One of the things that's important also is understanding that in certain socioeconomic strata, or neighborhoods, you may have certain things such as food deserts, where those supermarkets are not well equipped with variety of food. And if they are well equipped with a variety of food, we do know, unfortunately, when they know that that's the only supermarket within a 10, 15-mile radius, those prices go up. And if those prices go up, they're not able to afford that food. So if you're a single parent and you've got 4 kids to feed and you don't have a lot of money, but you've got some screaming kids, you're going to do whatever you need to do to feed them. So it's important that we look at this from a whole socioeconomic status in terms of trying to make sure that we get the proper foods in the proper neighborhoods with the proper information.
You mentioned earlier about physical health and taking care of yourself, how that takes care of your gut. What about the mental health part of that and quiet time, maybe relaxing time? How does that work?
I think that's absolutely key as well. So not only physical health, but mental health. Because if your mental health is not intact, then I don't know how many times you've been depressed, you've been angry, you've been tired. You don't eat if you're sad. And if you're not eating, then, the gut's not going to function properly. And if you are depressed, then you may not make the best food choices. So that's when we're eating our emotions. And that's when you're grabbing the ice cream, you're grabbing the comfort foods, which may not necessarily be the healthy foods that you have. And also sometimes when your mental health is impaired, you're not sleeping properly. You can't get enough rest. There's insomnia. And then that's when the hormones, leptin and ghrelin, are not in sync. And you may, once again, start to crave more sugary foods to keep you awake. You might crave more salty foods, so you're stimulating yourself. So your mental health is absolutely key to your gut health. And that's a phenomenal question. In addition, if you want to bring it in full circle, when you exercise, there are natural endorphins that are released with exercise that boost your mood, boost your well-being, and improve your mental health. So not only you're exercising, improving your mental health, you're improving your physical health. And when you look good, you start to feel good. And when you start to feel good, things just start to make a difference. And it helps deal with that depression. So instead of grabbing the cookies and grabbing the ice cream, get out and take a walk, and get out into the environment, seeing the sky, seeing the trees, seeing the sun, having that warmth and that vitamin D hit you. It makes a difference and it elevates your mood, especially during the winter times when it's dark. Try to get out there and get in the light, and all that affects your mental health.
Yes, and even being by the water, for some reason, the water also just relaxes you, calms you, and also gives you a sense of clarity. So we can go on and
Yes,
on.
we can.
And I just appreciate Dr. Donna for coming and speaking, and Dr. Lynn for coming and speaking today with us. And most of all, well, there's 2 most of all. Most of all, I would like to thank the Long Island Nets, Mr. Alton Baird and Wade and Griffith and his team for giving us the opportunity, because like I said, we've had a relationship for about 5-6 years, and so this is the first time we're actually doing a wellness seminar for them here. Our next one is going to be February 4th, so Jacinta is going to be working on getting that information out to everyone. So we're not going to be doing anything last minute. But the big shout out is to my live studio audience. Can I hear from you all?
Yes.
So thank you for realizing that the injustices in healthcare are something that we need to make sure that we focus on, but it also starts with us serving ourselves, getting in that 150 minutes of exercise at a moderate pace or going vigorous and hard so that we are a little breathless and can't really have that conversation for 75 minutes a week, which either one you choose to do, Dr. Lynn O'Connor and I, we are out there with you because we have to talk the talk and walk the walk because we care about each of you. But in order for us to serve you all, we have to make sure we take care of ourselves. So I thank the Fit Doc team for bringing it all together. And let's go Long Island Nets for a win.
Fit family, thank you so much for tuning in to another episode of the Fit Doc podcast. Today we talked about having a healthy colon, the importance of encouraging more females to go into the field of medicine, but also how to stay healthy. So tune in next time as we discuss more health and wellness projects. And don't forget to like, comment, share, and of course, subscribe.